Well, hello, everyone. Welcome back to the Better Together podcast. My name is Mike Baker. I'm the CEO here at Heritage Health. We have really enjoyed bringing these to you. I am so excited about our guest this week. We will be interviewing Dr. Joseph Abate. Anybody that knows Dr. Abate knows that this is one of those humans that just has a heart of gold. He cares about everybody that he comes into contact with. Dr. Abate is just an incredible cardiologist, spent his career in cardiology, and then actually joined the board of directors at Heritage Health, and then became our chief medical officer, and then worked with us for many years. And we developed some incredible programs. I think we discovered the key to changing and transforming the healthcare system with Dr. Abate. So that's going to be our conversation today. So you're going to really enjoy it. So grateful that Dr. Abate could be here with us today. I hope you enjoy it. Let's get into it. All right. Well, welcome everybody. We're so glad to have you back to the Better Together podcast today. As we talked about in the introduction, we're talking with the amazing Dr. Joe Abate. I'm so excited about this conversation today. We have known each other for a very long time. You know, as like talked about in the introduction, this guy has the biggest heart on the planet. Somebody that you always want in your corner, and has just dedicated his life to making this community a better place. So, with that amazing setup here, let's talk about like how did you actually get into this? I mean, I know versions of the story, but there's parts of this that I don't know that you've even shared with me. But how did you decide to like get into the healthcare side and then go from cardiology into community health work? That's a lot going on there.
Yeah, I think I was in cardiology for about 30 years. And toward the end of that career, I was trying to modify my schedule a little bit, and there was a job opportunity up in Sandpoint. So I was able to change my schedule and work up in Sandpoint a few days and have a few days off. So for the first time in probably 20 years, I was able to be involved in the community outside of a pure medical setting. And I was on the Heritage Health Board, and I ended up on the board of North Idaho College and North Idaho Hospice and the homeless shelter downtown. And during that time, I just had these visions of how these organizations could work with each other. And as that idea came around, that happened at the same time that Heritage was looking for a new chief medical officer. And I had the crazy idea that maybe somebody could do that. As a cardiologist, it didn't seem like the perfect fit because this is primary care, but we all have a background in primary care. So I think I asked you the question of could a cardiologist do this? And together we went down that path. And I've got to say that was the most rewarding part of my career. And I have no complaints about cardiology. I had a great time in cardiology. But making some of those dreams come true was just, it was a fabulous way to end a career in medicine. So
It was awesome. I remember that conversation, and it's probably a great pun here about cardiologists just being all heart or something there. But I mean, when you have somebody that's had that experience, in a career and then serving on boards and then understanding the mission of the organization, it was this really natural transition into it. And it opened doors for us, in the community. It opened doors for us to just think about practice different. When we have, so all our work together has really, we've tried our best to focus on how do you, one, improve care for everybody across the board, and then two, like how do you make primary care a sustainable job? I mean, we have seen burnout across the world, but definitely in the American healthcare system is very challenging. The burnout is real. We talk about it, like it can take your soul, and you saw that, and we have seen glimpses of what it can look like, and I think there's been incremental improvements across the board. But let's talk about like what is it about primary care being a doctor at a community health center, that's challenging and obviously rewarding as well. I mean, there's a trade-off there, but let's talk about some of the challenges of just being a primary care provider because there's a lot.
I think if you're a slave to the schedule, that everything depends on how many people can I see and how fast can I see them, that feels nothing more than treadmill work. And the beauty of primary care is that you get to know more about that patient than the average subspecialist does. But in order to do that, it requires a little bit of time and it requires a different kind of relationship. And the thing that I've always loved about what people could do with primary care, most of the illnesses we see, most of the visits that we see, are preventable. They're preventable problems, and even the chronic diseases are modifiable by things which can make it better. And so the concept of getting into a patient's diet and their exercise habits and their social habits and their spiritual life really can help to make that patient better more than just a prescription. And so that's always been a fascination for me. And I wanted to explore how could we do that within a primary care setting so that it's the patient's responsibility to take care, start to take care of themselves with the provider standing right there and helping them.
I love the team concept that you helped us sort of wrap into the organization. We're going to walk alongside you. I mean, there are always different paths in healthcare. Like you can actively manage your care and eat better and exercise and sleep and do all those things. And then there are people that aren't ready for that. And I mean, we do take medications. There's a path there that you can have a version of life through that, and it kind of works. But we saw some really powerful things as we started early on. I mean, there was a big project related to the opioid crisis in the community. And I mean, Dr. Abate spent many, many dark nights in the winter of North Idaho working with patients hand in hand on this team thing and literally saving lives, working on adjusting doses, convincing people to think about something different. Let's talk about that just a little bit, how that flipped, because I think from there we started to really work on nutrition, fitness, lifestyle. A lot of those things kind of spun after that, or my brain's mixed it up. But
Yeah, that was a huge challenge to begin with, and it was a problem for many patients, and it was a problem for many providers who were stuck trying to take care of those folks. And the bright side was we helped so many people. It wasn't easy, but we helped a lot of people, and we brought some order and some sensibility into the world of chronic pain management. Once that was under control, I think we began to focus on what could we do to help patients. And I love this idea. I, like many people, kept hearing over and over again that patients don't follow your orders. They don't do what you tell them to. And really, that's a reality of life. No one does something just because you tell them to. They need to see you working with them. And so we had this wild concept that, well, what if we were able to see people in a gym so that once we were finished discussing what their issue was, they were right there, they could just go exercise. And then later we brought the dietitian in so they could do exercise and they could get nutritional information. And then later we brought some behavioral health people in. So there was this concept that no matter what was bothering that patient that day, we could have somebody to help them through that moment, and they could continue with this exercise and diet regimen. And lo and behold, they all showed up. And it was amazing. We went from, I think, 10 or 12 patients in the first month to about 60 or 70 patients in 3 months, and got up to about 150 patients a week showing up at the Kroc Center with all of our providers involved. And they were changing their lives, and it was their power. They saw that it was within their power to make all of their issues better.
no, I mean, it was incredible to watch that thing, develop. I mean, we had our friend Bill Davenport and the folks over at the Kroc Center that we worked with. And I think it's always so much fun when you come together with this crazy idea. I mean, because it's not a typical thing in society. You're like, okay, well, your doctor's visit's going to happen at the Kroc Center. We were in the party room most of the time, and so we're sitting there on the chairs there, and patients, they have to have time with the doctor during the visit, and then we have the classes that we're teaching. But the group dynamic was so cool to see, like as patients were interacting with each other, but also the provider in the room. I think the relationships got deeper, and you're able to inspire people to think about healthcare just differently. And we met them where they're at. We didn't say go run a marathon today. We said let's get on the treadmill and we're gonna walk for 5 minutes, and let's talk about that just a little bit.
I do want to give thanks to the Kroc. They were so helpful to us. And it was actually Bill Davenport who came to me and said, we have some people working on a treadmill. We're worried. Can you do histories and physicals on them? And that's when I thought, well, why can't we just go there and have our patients be there? And so there's physician presence there, and you have people that are actually doing the thing that you've always wanted them to do. But what we noticed early on, within weeks, I said to my medical assistant, one of the biggest things we're doing here is reducing social isolation, because people get alone and they get depressed. And when they're depressed, they don't take care of themselves as well. And it's just a big spiral. And we were able to get these people out, get them into the room where we could watch people exercising in the pool area. And lo and behold, people came out of their shells. They stopped depression medications. It was just a wonderful experience for them, and that translated back to how the providers felt about taking care of these people.
And I think the magic, there's lots of things that were magic about the program, but I credit people like Izzy and, the providers. There's this case management support approach that has to be a primary focus of doing this. We're asking patients to do something different, and we're also trying to convince them to do lifestyle changes. So it's hard. I remember a couple of conversations where there were patients that I think they would call Izzy and they said, "Well, I didn't actually exercise this week. I'm going to cancel my appointment," because they were feeling like guilty that they had to come tell you that. And so I think Izzy did a good job breaking that down. It's like, look, there's no judgment here. Show up and, we're going to work on it. But I love the human dynamics that came through that. And even after, the program really, man, it went crazy. At some point we had to slow it down and things they took a little break there. But, you carried this on, in partnership with the Kroc Center through today. Talk about that a little bit, and then, we'll see where we go from there.
Yeah, I think that it was an 8-week course, and then the feedback that we heard from patients was, we really need somebody to follow up with us after the 8 weeks, and we need some kind of accountability, and we need somebody to continue working with us along that goal. So we had a trial where we followed a dozen patients, and it was a little bit less than a year, but there were a dozen people who volunteered to come once a month, and they would be exercising in the meantime. And we would meet, have lunch, and there were some incredible conversations that didn't take place anywhere else. And these people had incredible changes in their lives. I think, we had 9 women in the group, and I think out of those 9 women, 8 of them had been sexually abused, and 2 of them had never told anybody else. So here are these people that are within the healthcare system. They never told a behavioral health person. They never told their medical provider. They're sitting at lunch with a bunch of strangers, and they're opening up their past and getting to a new place in life. And I realized that, people have a story. Everybody's got a story. And if you can't uncover that story, it may be very hard for you to help those people. And the beauty of bringing people together is that those relationships help people to unpack their stories, and you can have a different environment. And the team helps. When you've got multiple people, not just provider and patient sitting in a room together, you've got somebody to talk a little bit about their behavioral health symptoms, somebody to talk about their diet. And that team approach and the team effort is really very valuable.
Yeah. And And I think that's what I love so much about primary care is, I mean, you're sort of the quarterback in the game and you're watching for all of this stuff. But at some point, you do have to run the ball into the end zone. And that really requires the patients to trust the team. And, I remember conversations where patients are like, I just can't do this anymore. It's too hard. But the social side of things really seemed to lift people up and convince them that we can eat better, and the nutritionist would work with people with what they have, help them be healthy. I remember the class where I think the chef was in the class with it, and he's like, well, if you want this to actually taste good, here's some tips. And so patients are chiming in, and you're building this really cool thing. So I think we got a glimpse of what primary care could look like if we think about it differently. Now, program closed. We've done some shared medical appointments over the years. We haven't quite got to the level of success that we had with Kroc RX, but rolling into, so Dr. Abate then retired, started fixing bikes and doing all the cool retired things, and then recently you had a change in your life. What was that?
Well, I think, after I retired, I mean, I did a few of the usual retiree things, but my parents were sick, and so they needed some time. So I had a few years that were very involved. And then recently, I just, we're on the process of opening the Center for Healthy Living, which we talked about that 10 years ago. And the idea has remained, and bless your heart for keeping that idea alive, because I think that the concept is still there. So it seems a great time to bring us back to the place where we can do medicine in a way that not a lot of people are doing. We're not totally unique, but not a lot of people are doing it this way, number one. And number two, it works. It works, and so we're kind of constrained by a system that just, you get paid for visits, and we do things that maybe it works, maybe it doesn't. But if I had a choice of whether to add another medicine for diabetes as opposed to getting somebody exercising, I'd rather have that choice. But to do that, what we need is the provider alongside the patient and the team saying, we can do this. We'll show you how to do this. We can do this. And I still think that that is the future that makes a difference. And everything I've done since then shows that. I volunteer at the Kroc Center now doing a goal setting course, and we help people set goals who are just not used to setting goals. And it's hard, it takes time, but once they realize that they have a plan for how to set a goal, all of a sudden they can set all of their goals. And it doesn't matter what their goal is, whether it's body, mind, spirit, financial, doesn't matter. But it's just walking alongside someone when they do that and knowing their story.
Yeah, I think it just goes back to that. You're not walking alone through whatever journey you're on, and having people that you can relate to and connect with. As we've been working on Center for Healthy Living, coming in, so Dr. Abate is back serving on the board. And then, last February, we got the behavioral health side moved into the Center for Healthy Living. And then this year we've been working on the design concept for phase 2, which will bring in medical and dental, pharmacy. And then we're creating this really incredible community space that will be the home for all of this. We'll have space to work out. We'll have space to learn how to eat better. There's community gathering space. We happen to be on a beautiful location where, even in our winters lately, you can still walk outside, but you're right on the river. You've got the trail. We are set up in this ideal location. The dream's coming true. It's going to be so cool to watch it launch and take off. Some of the patients that you've worked with over the years, how do you see something like the Center for Healthy Living benefiting the patients? And then I want to talk about what that does to the providers that are going to work in that system. I think if we can hit those two things next.
Yeah, so my analogy is somebody asks you to bake a cake and you think that's easy, I can do that. And then they tell you that you need to go to one store to buy your flour, and then you need to go across town to another store to buy your eggs, and then a third store to buy your butter, and then a fourth store to buy the sugar. Suddenly that looks and becomes very difficult. So how can it be a bad thing to bring everything that a patient needs into one place, one building, so that if they're there, they will have medical, dental, behavioral health, pharmacy. It's all there. And so it becomes so much easier, I think, to point a patient in the right direction and be able to be there along the part of their journey. And once they can do it independently, they may not always be exercising there, but they'll be exercising somewhere. So I think that concept is still a great idea. And it's something that we should pursue because I have seen it work. And I think that when you have the patient become engaged in their own health, rather than presuming that they just show up for a visit and the doctor is supposed to solve the problem with or without a pill or a new prescription, they realize that they have some power over their health and their wellness. And so you suddenly have a different conversation between the patient and the provider. And for the patients, it's very satisfying to be able to say, how's your diet going? How's your exercise going? And to share that rather than saying, okay, here are the things you didn't do. Here are my orders. Go do this and you'll be better. And pretend like, it's just going to happen if you do exactly as I say. We have to work with patients who are in their place and have issues that we don't quite understand. I always say that there are people that you don't understand why it is that they can't get any better. And a lot of people say, well, if you're in a diet and exercise program and you're losing weight, well, that's a success. But if you don't lose weight, then that's a failure. And to me, that's the person you need to have red flagged so that you can go and dig into that more and find out why that's not happening. That's exactly the patient that you want to see. And that's the perfect place to find somebody who's resistant to usual treatment and come up with a different solution.
No, I think if there was ever a program that embodied what Lidwin Durney and the founders and everybody, wanted to see from the organization, our mission is to improve life. When you can improve the quality of life for people as they're going through that, and whether that's a weight loss thing or not, the human interactions with these groups and the providers and just building relationships, there's improvement right there. We've seen that sort of reducing the social isolation and just feels better when you've got people around in your life. But then, as we saw patients, I think we saw hemoglobin A1C scores dropping, we saw depression scores getting better, and we had several factors through the U of I study where it was like, there's some tangible metrics that are demonstrating that this is improving life. This is something worth exploring. Obviously, we need to do more research, but it was pretty easy to look at the faces of the people interacting with the system and seeing people smiling and getting better, to know that like this is worth it. This is the right thing to do. And we didn't necessarily make this up. There's the shared medical appointments. Was it Mayo? With the Mayo Clinic that they had a model that we sent people out. We learned how to do it. This is something that's really, really cool, but it's different in the healthcare system. And let's flip into the impact of the providers in the healthcare system. So you have a choice. You could work anywhere. You can work at a typical practice, and there's a lane there. Or I don't know why people wouldn't just come to Heritage Health, but when you look at the lifestyle of the provider, seeing the ability to actually make a difference in the patient's life and see those outcomes, I think that's got to be motivating. But when we think about a provider working within Heritage Health, how is this going to benefit their lives?
Well, who wouldn't want to be in a system where the patients are engaged and you have an opportunity to actually show them all of what they need to do, not what you need to do as a provider necessarily, but what they need to do to get themselves started on a path to a healthier life. And then it becomes it's a cooperative effort between the two. And it's a different conversation between the patients and providers. So if the provider's got a team of people who know what that patient needs, and you can funnel them into those places, and you know that you're not sending them all over town. You know that you're not giving them 5 different appointments. You know that it's not going to cost a lot of gas money for somebody who can't afford that gas money. It's right there. And it's all contained within your building. You can show them how to do that. And they start to feel better. There's no question. We had something like a 60% drop in depression scores in 8 weeks.
Oh, that was cool.
And
Yep.
patients coming and saying, I don't think I need to be on this depression medication anymore. And you can stop a medicine that costs $1,000 a month. That's a great plus. So I do think that the thing that providers most want is they most want to feel like they've given the best care to their patients. And if they don't, they're heartbroken, honestly. And so a provider just feels better when they can see that their patients have the opportunity to do all of what's good for them.
I love that. I mean, I think, I think we've used the phrase sort of restoring the soul to healthcare. I mean, there's ways that, we can really look at the healthcare system, do it differently. Like, look, we're not perfect. Like, I know that we have providers that are tired and worn out, and they're like, administration. But I mean, there's a lot of challenges and complexities when you're running the healthcare system. So, you've served on the board, worked with us, and then back on the board, you see that lens of, okay, like, we do have to keep the doors open. We have to, have a financially viable organization so that we can meet our mission. And I love the dynamic that you bring in the conversations. It's all about balance. Like, we have to find that balance and say, okay, yes, we are here to take care of people and our patients, and that is the thing that comes first. We utilize the system to generate the resources that we need to have the teams in place and walk through that. It's hard and complex. So, the state thinks about, cutting Medicaid funding or, doing these different things. So every day, we're out there trying to juggle these things and then try to set it up so there's a consistent system for healthcare providers to work in. I think it's a complex, dynamic thing. But as we talk, because I know we have lots of legislators that listen to this, but when we think about national policy and healthcare, I mean, it's become one of those things you're not supposed to talk about in polite company because it's controversial. But when we look at some of the components of the Make America Healthy Again plan, I mean, there's several things there where community health centers, we've been sort of MAHA all from day one, where like these types of things really show that community health centers can be agile and make a difference. Do you think it's realistic that if you started to improve the health of patients and they started going to the emergency department less, do you think that would reduce the cost of healthcare system? I'm giving you a softball here, but
Yeah, I think that if you wanted somebody to know about a diabetic diet, is it better to squeeze that into 5 minutes of your 20-minute visit, or is it better to have a dietitian speak to a room full of patients, telling them all the things they need to know for an hour? That's obviously better. Is it easier to tell somebody for 20 minutes how important exercise is, or is it easier to say, here's my message in 5 minutes. Exercise is really important for you. I'm going to take you down the hall, introduce you to our lifestyle management person, our exercise physiologist, and they're going to get you started on an exercise program. And you are going to do the exercise 3 times a week. We know that if people follow a healthier lifestyle, you're going to see less high blood pressure, you're going to see better cholesterol levels, you're going to see lower incidence of diabetes. We know that if you are pre-diabetic and you exercise, you're going to reduce the likelihood of converting to diabetes by 60 to 70% in the elderly population. And right now we have 1 of 4 people over 65 who are diabetic in our country. If you were to just change that even a little bit, the cost of care would go down. Not to mention all the medications that people are on that I'm convinced they don't necessarily need as many diabetic medications, as many antidepressant medications, many of the high blood pressure and cholesterol medications, if we can do the things that do work. And I don't think it's that hard. I think patients are willing to do that. We need to create a system that shows we're here to help you in that system. We're not just giving you orders, we're going to show you how to do it. And we have a place right here in the Center for Healthy Living where you can see how that's done. How can that not improve health across America and reduce the healthcare costs?
I mean, I hear you saying, there's an open invitation to anyone that wants to learn about improving the healthcare system. Come help us. Come help us figure this out, right? I mean, we know that we're on the right track. We have a building, we have providers, we have resources, we have community support. We're open to ideas from anyone that wants. Like, if you're a legislator, if you're a healthcare policy person, like if you want to change the healthcare system, we're actually all into that. Like, please do. It's not a great system. We can do it better. We're looking at this managed care solution for Idaho, and I mean, there's things that you can look at that really incentivize the outcomes of healthcare system, and I personally I think those are great things. Let's get paid for improving outcomes. We also have to work in a fair system that allows us to do that, and so really looking at that primary care base, keep that strong. As you look at it, you got to keep that primary care base strong so that we build a better future for our community. And I mean, it's going to be so exciting to watch this come together. It's hard because we're talking about this. So we're end of January. They've done the demolition on the other half of the building. We have a groundbreaking on February 5th. If this airs before that, that's awesome. Come check it out. But I mean, we're going to watch this thing come together. The plan is to have construction done toward the tail end of summer into fall. So we're going to say between September and December, we should start moving people in and start seeing patients. It's going to be on recording, so we're going to say by January 27, we're going to be seeing patients in there, and it's just there's already magic in the building, and then plugging this side into it, and then building these other components. I think this community's in for just this welcome surprise that healthcare can look different. It can be fun. You can love your job. You can actually enjoy going to the doctor's office and, participate. We're going to see reduced healthcare spending. We're going to see better outcomes. I mean, we go back to the promise we all made to, Lidwin and the founders and just our jobs. Like, our job is to build this thing so that it fulfills the mission. And I think we're on track. And we're going to have headaches and bumps and bruises along the way. We're going to worry about funding and all these sorts of things, but I can't wait to see that. Um, let's move it. So as we kind of wrap up the conversation today, let's think about, I like the one about sort of a newspaper article 5 years from now. So you wake up in the morning and you go grab that Coeur d'Alene Press off your porch. What's the headline article in the paper that sort of shows that we've arrived? You got one off your top of your head?
It might be hard to squeeze that down into a headline, but I see people who walk into a building and they see all that they need to live a life of health and wellness under one roof. That's what I see. They don't have to drive over town to get it, and they are seeing all of the equipment that they need, all of the knowledge that they need, all of the staff that they need right in one place. And it becomes the focal site for, if you want to be well, if you want to be healthy, that's the place to go. It's not just the place to go to get another prescription because you just can't work your way into a healthier lifestyle. It would be the place where you learn how to do that. And I think there's something so attractive about showing patients that they can have control over their health. They just need our help. Mm-hmm. And we'll give that help. And it will be right there because everything we need will be right there. That's a very long headline.
That's a great headline. Hey, it's fantasy headlines, so it can be as long as it wants. I love it. I mean, that's the future. That's what we're looking at. Dr. Abate, you have had such a huge impact on my life. You've been a friend, a colleague. We've lived a lot of life together. Just thank you. I've worked with lots of people in my career. I don't know, Dr. Bhatti is just one of those people you always want on your side. And, having a big heart like that, he shared it with me and it's benefited my life, but it's spread throughout the organization. And anybody that's met Dr. Bhatti just knows that there's somebody there that cares deeply about him. And just thank you. I mean, we we talked about with helping professionals, you're oftentimes sharing a part of your soul with somebody. And sometimes that gets restored. You pick it up from somewhere else, but sometimes there's a deficit because you share too much and it's out there. But it's in the nature of people like that with big hearts. That we're gonna share. We want to make the world a better place. So thank you for all of your years of service and just believing in the work that we do. And it's gonna be so much fun the first time, we see patients in that space. And you know, just trying to keep that momentum rolling since you left, and having the space there it's a dream come true, and it's gonna be so great.
Thank you. I mean, you offered me the space to have those sorts of dreams and to actually put them into play and see that it works. So I think you and I both know that it will work and that it's what people need. So I'm very grateful to you for giving me that opportunity.
You're welcome. All right. Well, listen, this has been an incredible episode. Thank you so much for joining us this week. Couple takeaways for today's episode. So, if you're a provider that's just tired of working in a system that doesn't believe in you, I mean, you should check out Heritage Health. We're hiring. We want amazing people to come just usher in the future of primary care. So there's our promotion pitch for recruiting. Come join us. Come be there. And then, patients and community members, check us out. I mean, you are missing something incredible with the providers that we have at Heritage Health, the system we have built out. This is a gem in the community, and we are going to, like, every single day, we just work on getting better. And if we miss something, we drop the ball. This group, we rally, we figure it out, we problem solve, and then we just get better. So we're grateful, to you for participating on the podcast today and listening. Leave some comments. Please go ahead and hit that like and subscribe and follow all those buttons. That's how we keep this thing going. So thank you for being here with us this week, and Dr. Bhatti, thanks for being here.
Thank you very
We'll
much for
see
having
y'all
me.
at the Center for Healthy Living soon.